Hi, I'm Ellis Thompson-Ellis, and I'm a community outreach specialist for the Grand Junction Fire Department. I've been with Grand Junction Fire for about 5 years. I'm a civilian employee, and previously I came from the world of education, which translates to a really good base in risk reduction for education and instructional design across all age levels.
My name is Rebecca Clark. I'm the life safety educator at Windsor Severance Fire Rescue in northern Colorado. My background in community risk reduction really began as a firefighter when I was a volunteer firefighter, and I got to do business inspections. As our crews, we were required to do a certain amount of business inspections each year, and that was really my first introduction into community risk reduction because I had to learn why we do business inspections. It's a preventative measure. And so that's really what got me started in community risk reduction.
Sunny Smaldina with the Colorado Springs Fire Department, and I am the supervisor for the Community Education and Outreach team, which is under the Division of the Fire Marshal.
Our community risk assessment overall considers a lot of different factors in our community. We really started with the basics of demographics, population density, and then we looked at natural hazards in our community, things like floods, wildfire, wind events, ice storms, things like that, and kind of looked at how frequently those things occur and when they do, what the risk level of them is. We also layered in and kind of looked at on a map our calls and separated them out. So where are our cardiac arrests happening? Where are wildfires happening? Where are structure fires happening? And then when in the year are they happening? All of that is the base of where are emergencies happening and why. And if we can predict them in terms of a population or a season or a location, then we can use risk reduction techniques with the 5 E's to try and get ahead of some of those problems.
So the way that we are working on our community risk assessment through the Colorado Springs Fire Department is first establishing our team. It took a while to figure out who were the right players to be part of that team. And the original team that we looked at, we realized we needed to make it a lot bigger. So our team consists of about 12 people. We've included our operations side, our medical division, clearly Division of the Fire Marshal on that side, our new construction side of the house that is doing plan reviews and dealing with the new growth. We have our other side of the house that's dealing with the existing building stock that we have. We have our educators, our training division, we have our administration. We have a couple representatives from administration. Our finance and statistics person is in there, which is a huge asset. And then we also have included our employee labor union group representation so that we had kind of this whole holistic view of what was happening in the department with our firefighters, with our civilian staff, with our inspectors, our investigations, so that we had a good, well-rounded view. And I think we were too narrow scope when we first started. So once we've established our group, we've met and assigned tasks. So we started with getting data. That was, and still is, continues to be, and will forever be, no matter how good, the biggest challenge, I think, of just getting over that first step one of finding data. And that comes from all different sorts. And is it good, is it bad? Deciding what you are okay with was really been a challenge for us, for sure. And then in the middle of it, we changed our fire reporting system. So we're trying to do apples to apples when it's really apples and oranges that we have to look at differently, figure out the similarities, and then start compiling what that looks like. So that's really the big step that we started with. So through the data collection process, we were really able to look at what was popping up more frequently. So our most frequent calls, or the things that people were perceiving as problems, or our crews were perceiving as problems, and then validating it with data. And really determining, is that something that we wanted to include or exclude? Is it a problem that we thought we had we don't have anymore? A lot of things have changed that way, so I think those things were really, really key to that. Finding our community partners that had data was really a big challenge, but it's been great because now we've grown our stakeholder base. And that was kind of the next step, was to take all this data And then, though we knew what the problems started to become and what these risks were, we needed to know what the perception was in the community. So taking those stakeholders and surveying them and asking them what they felt the biggest risks were, what they felt the biggest challenges to the department would be. Then we asked our internal 600 employee group on the fire department, what do you think? Because we wanted to know what they thought as an employee and as a community member. So that was really great to put all that together. And the funnest part was taking all of it and asking our fire chief and our deputy chiefs. So the really fun part was taking what we had gathered from our employee group, from our stakeholder group, and then we were able to include our chief group. And when we layered what they felt and perceived were the biggest risks and the problems in our community compared to what the data showed, compared to what our employee group showed, it was very different. So it was really good to start acknowledging perceived risk versus what was found. And then now we get to all have those big, tough discussions of what we need to continue doing, what we need to stop doing, and what we are missing and where those gaps are. So that is kind of the process in which we're in right now, is going out to a broader audience in our community groups in these specific areas and asking, this is an identified concern, where do you rank it compared to everything else in your world? So that is the next step that we're headed toward, and really working with all of those partners to really make that happen.
Completing our community risk assessment took about 6 months. We had never done a formal one like that before, and so it was very in-depth because I was coming on as a new employee with a new division. We hadn't had our life safety division before, and working with the pilot program that I worked on, it was a 6-month process before we had our CRA done. So I was really fortunate when we created our CRA that I did not have to do it alone. I was part of the NFPA's pilot program for what is now known as CRAG 1300. As part of that pilot program, they were having us share our different data, how we would use it, and then my sidewalk build it all into a CRA for us. And that's what took about 6 months, as we started on the very groundwork, and we learned what was working with and what wasn't working with getting them our NFIRS data, our demographic data. We learned in the beginning that we had to use census tracts rather than just city borders, because we have multiple municipalities in our district, and that was a problem at first, was getting that all into CRAG. So I was really fortunate that I was able to work with NFPA and my sidewalk on that and help develop what is now known as CRAG 1300.
We do have a wildland fire team here at Grand Junction Fire, where a small portion of our employees, we're looking at about 30 people, have their red card certs. We do have 2 wildland engines that are able to deploy. They go and get experiences on those fires, bring it back to Grand Junction. We also have wildland fires here that they're very familiar with. And so getting buy-in of the wildland team, it's an opportunity for them to train. It's an opportunity for them to give back to our community. And honestly, that wasn't a hard sell to them in terms of being a stakeholder. For our external agencies, everybody kind of has their piece of the pie, right? That the environmental groups are looking at riparian habitat and watershed health. Same for utilities. Our electrical companies are trying to protect their assets. Our realtors are trying to protect their future in real estate and real estate value. Our park service is trying to maintain quality of life for our community, public health, air quality, and so everybody had, honestly, a very clear purpose when they showed up to that table. And again, it was an easy sell that we should all be working on this together. The process of strategic community risk reduction comes out of public health. And so in terms of stakeholders, they're very familiar with that. We do also have emergency management, which is familiar with risk assessments in general and all hazards and emergency planning, things like that. But we do have stakeholders at the table, our private industry, where they have risk assessments, but it's not necessarily for the whole community. It might just be for their assets, if that makes sense. And so getting folks together and understanding everybody's priorities and physically mapping them out was a huge benefit to us, to know where water storage is and important watersheds where other projects have already happened in terms of mitigation and where we still have work to do. One of our highest risk areas for wildfire is along our river corridor, and that's actually a place where we also have a high incidence of people that are experiencing homelessness, and that's where they're residing, coming in and out of. In part, we do have cooking and warming fires from that population in that area. So when we are looking at a mitigation project, the first thing that we need to do is reach out to anybody that may be in that area and work with them to make sure that they're connected to community resources before we just go in and take over and do fuels thinning. So working with our police department, they have a really great awareness of who is where, what resources are available to that population, and how to bridge that gap when we're looking at a project area, get people to a safe place, make sure that they are safe, and make sure that we've got a safe area to work in once that project is about to be underway.
The other stakeholders that we have included into participating in this group are the hospital systems, our school districts. We have 6 big school districts. We have several charter schools, and then we've got our private schools. So we've got a lot in that school section. We have all of our big contractors in town that participated. We've got our law enforcement agencies, both the sheriff's office as well as the city fire department. We've got our building department folks that were in there on permits and reviews that we work with. So we've got a lot of just additional agencies that not only work in the public safety sector, but we've included kind of as our working partners, the people that we work with the most. And we also send out to all of our healthcare facilities, hospitals, assisted living, apartment management people, HOAs, you name it. We tried to track them down, and we sure did a good job of doing that. I think we ended up with like 480 different unique key people that are instrumental in working with the fire department. The other thing I'll say about our stakeholder group is we really wanted to find a group of people that had a baseline understanding of what we actually did, because it's very unfair to ask somebody who has no knowledge of what a fire department does, what they feel are the biggest risks, and what we face as a fire department, and what our challenges might be as a fire department if they don't have a working knowledge of what we actually do. So this really required finding those people we work with that understand just a foundation of what the fire department is about, the services we offer, how we can support them, and what we do in the community. Most of our community members just think we show up with the big red truck when they call 911, and we just go to fires. And so asking the masses that question would be it would sway our findings quite a bit. So working with those folks that had a baseline understanding was a key thing for the stakeholder group.
All of my programs here at Windsor start with a project proposal. So in my project proposal, I needed to identify the need, the risk associated with it, the hazard that it would address, the cost-benefit analysis, and who I could come to for help. We have worked with the Lauren Project before on getting the number of carbon monoxide alarms that we needed to install in homes, single-station carbon monoxide alarms. And then once we started getting this program on the scale that it is, I started working with other stakeholders. I worked with the Windsor Rec Center. The employees there hand out flyers to the seniors. They have a senior luncheon every Wednesday, and they hand out flyers to the seniors to say, hey, have you signed up for free smoke alarms? The town of Windsor, we collaborated with them on a 30-second infomercial that they helped us film, and then they've been running on their local television station here in Windsor. The town of Severance did the same thing. They included it in their newsletter. So we've really been able to use our local municipalities, our senior groups, our rec center to get the word out and to get people to want to know. Most of our participation in this project has come from word of mouth. As soon as we tell one person, or I go into one house and I change their alarms, forms and people see my Sparky van, I get 10 calls. They just like, can I have a stack of your cards so I can pass these out? And so that's really just using the community members that we have and the great recreation and relationship that we have with our town governments has helped.
You know, a risk assessment can be daunting because it can be as big or small as you make it. And I can already tell you in our risk assessment, we did a good job. But once we realize, oh, we're going to need a stakeholder for this risk or this program, we can already see areas to improve that. And so I think first and foremost, whether it's your risk assessment or rolling out a program or a pilot project, it's constantly looking at, did this meet the intended goal? Did we capture everything that we need? Do we have everybody that we need at the table, right? And then once you're looking at rolling out programs, did we meet the right audience? Were our materials good? Were our instructors prepared, right? And then were we able to demonstrate a change in knowledge, behavior, or beliefs about whatever subject we're looking at? So from the time you decide to do a community risk assessment all the way through, you should be evaluating, and that doesn't mean it's a test or a check sheet, but it could be check-ins, right, along the way to make sure that you are still headed the right direction, that what you're building is meeting your needs and your community's needs, and that you're delivering the best product that you can to the community.
So the evaluation process that we have been utilizing so far through the process is looking at our program appraisals we use for our accreditation. So that has been extremely helpful to look at each different program that we have going, that we evaluate every year, and making sure that that is something that continues to be one of those markers that we look at. How are we doing with it? What effect did we have? Did we make change? Did we slide back? Did we stop doing it for one reason or another? Because we've had a laundry list of programs and we've literally had to say, due to staffing or due to our massive growth, we can only do so much. We can only do these 3 programs instead of these 5. So I think those are things that we are constantly looking at, and it's been good to see the things that we've stopped that we need to bring back. And then some of the things we stopped, we really don't need to be doing that anymore. But it also has forced us to reinvent the way we do them and working smarter, not harder. And how can we be efficient? How can we, grow those partnerships so we're not running parallel with our partners, teaching the same thing or trying to do the same thing? Doesn't make sense. Doesn't make sense that there's 4 PD crime prevention officers and there's 3 prevention for fire, but yet we're going to the same place. They go one month, we go the next, when we could just partner, train the trainer, they can do their spiel, add ours on, and vice versa. So that way now we have a power of 7 instead of a power of 3 or 4. So really finding our partners in that has been a great way through the evaluation process of who's doing what and what programs are they doing that makes sense to partner with them on. And that's really helped us kind of guide some of this decision making as we present what should be in the plan itself.
Yes. So evaluation and efficacy is so important in any program. And starting off with this, when I started creating our program on the larger scale that we did, I knew that I would want to collect different points of data. So I reached out to friends in CRR across the nation and said, if you guys were implementing this program on this scale, what types of data would you want to gather? And so they would give me ideas, and I would create this form that we fill out for every home safety visit that we do. And I was like, yeah, this form's pretty cool. I like this. I'm getting all this great information. And then one of our board members sent us an email and was like, hey, I really want to know this number, and this number. And I'm like, oh, I wasn't collecting those numbers yet. So I reevaluated. I was like, that could show me the impact on this or this part of it. So then I redid my data collection form again to include those points on it. The other evaluation was knowing how quickly the word of mouth spread was on this, that I wasn't able to keep up. We had 30 people waiting in the queue, and I was scheduling 3 weeks to 4 weeks out. And so that was evaluating that it can't just be done with one person, and that's when we decided that we need to bring in a line firefighter to help with that. Another evaluation that we have done is when we originally did it, when I originally had the proposal, I estimated 2 dual alarms and 5 smoke alarms in each residence, but in a lot of the homes that we're going in, it's more than that. So I had to reevaluate and see how I would still be able to reach the largest audience possible in that amount of time. So we had to readjust how many homes we thought we'd be able to cover by the end of this period.
Wildland-urban interface, CRR, is special to me because it not only protects our community and our quality of life, but it's also looking at protecting the health and safety of our crews and the crews that will be called in for mutual aid incidents. And I think community risk reduction, don't forget about your own firehouse and your own crews in that. Make sure you're including them as stakeholders, but make sure that you're serving the entire community.
To me, community risk reduction is taking a specific approach for a specific audience, and it isn't taking the same thing and just going and talking at people. It is really talking to them about what they need and trying to figure out how do they change their behavior to make their world a little bit better, a little safer, that they're not gonna have a house fire, they're not gonna get hurt, they're not gonna need that 911 call. So it's not a plug and play. We can't just take the same program and apply it across the board. The process doesn't change for the program. It's what you're saying, how you're saying it, and who you're saying it to. And it's not gonna work in every community. If I grabbed a program from a partner in a different area of the state, I'm gonna have to tailor that. I can't just take it and go talk at people. I need to talk with them, find out what is their problem, and really work on that.
As a huge advocate for community risk reduction, it's something that I believe to my very core. I think that if we can keep our firefighters from having to respond to emergencies that could have been prevented, or if we can give our community a better sense of safety in their own homes, then that really shows why we have such a focus on risk reduction. Because it would be so much better if we can handle preventative measures rather than always being reactive. And that's what CRR is about. It's about prevention rather than reaction, and using that together, we can just create safer communities.
Make it specific and not just a generic, out of the box solution we use for everything.
If you're a fire department that doesn't have a community risk reduction program, not only think about your community, but think about your firefighters. Think about the child that they had to pull out of a car because their car seat wasn't installed correctly and was injured, and the impact that that has on them, remembering that. Or the home that they went into where they had to bring out somebody after the fire because they didn't have working smoke alarms. You can help save not only your community and make them safer, but you can save your firefighters those memories, those images, and having to respond to those types of emergencies. We've been on accidents. I mean, there's people who are like, dude, if you had been wearing a seatbelt, you wouldn't be dead right now. Right. And that's something that we have to live with as firefighters, is those images of those emergencies that we responded to. And by using community risk reduction, we can cut down on those images that are in our minds, so that our bucket, we no longer have to keep throwing those balls in until they all start to fall out the top. On here, because as much as they tease me and be like, oh, you're putting me out of a job, I'm like, why do you want to respond to a home and drag somebody unconscious because they just got carbon monoxide poisoning? Why do you want that? I don't. I can never get rid of the images that I've seen as a firefighter, but if I can somehow create programs through community risk reduction that makes it so my fellow firefighters never have to see those same things, then I consider that a win.
For your community risk assessment, just get started, right? It doesn't have to be huge or complex, but the more partners and stakeholders you bring into that entire process of looking at what's going on in our community, what are the risks and what can we do about it, the more voices you have at the table that are truly invested in the health and well-being of your community and that can play well in the sandbox together, the better that outcome or that product is going to be for the entire community.